Healthcare educators use simulation for training in a safe environment. Currently, they use a combination of standardized patients, mannequins, and computer-based simulators. Standardized patients cannot change physiology at will and are not available for children. Mannequins offer a good control for physiology, but have a static appearance and uniform body temperature. Computer-based patient simulators can show dynamic appearance, but are typically displayed on a flat computer screen, lacking physical shape. The physical virtual patient bed is a new type of simulator that supports the patient's high-level responses, for example, speech, eye gaze, and facial expressions. It also supports the patient's low-level responses, for example, physiology such as breathing, pulse, localized temperature. My objective is to combine all the sensory cues, including subtle symptoms, in one location as the patient. The physical virtual patient bed can show diversity of patients, for example, adult, child, male, or female, all with different ethnicities and backgrounds. Also, it can show a variety of medical conditions by quickly switching between them. I worked on the hardware, software, and content development of the physical virtual patient bed. I designed a 3D shell in Maya and simulated the projection with another PhD student before reaching an optimized shape. The shell is smooth enough to allow for a non-matching graphics to be displayed on the shaped shell with minimal distortions. A mold was milled from the 3D CAD files and used to vacuum form plastic to create the shell. The shell is easily removable and can be replaced with another shell as needed. Two projectors are attached to the rig and they project dynamic visuals on the shell. Cameras in the 3D scene are assigned the position and rotation of the physical projectors, looking at the 3D model positioned in the same location as the shell. The imagery is then sent to the projector. 5 personal heaters are positioned at different body parts to simulate localized body temperature. For example, the head can feel warmer to touch than the hands. 2 audio haptic devices simulate pulses from under the shell. A speaker outputs the patient's speech. Here is a view of the physical virtual patient simulator from different angles, showing the hardware and the sample projection of a sick child. I'm also exploring different materials and methods to simulate skin in a way that preserves the projection's quality and allows for touch sensing using infrared lights and cameras. This is a skin prototype for the head of the patient. In collaboration with subject matter experts from College of Nursing and College of Medicine, we identified medical scenarios to develop for the physical virtual patient bed. I created content for a healthy child, a child with early signs of sepsis, and a scenario with a child that shows signs of abuse for healthcare providers to recognize and report. To develop the content and software, I researched reference material, then I created a 3D model for the child, textures and UV maps, joins, and rig for the 3D model. Then I created 3D facial expressions for emotions and speech. I used a Unity plugin software to map the Visemes to the recorded audio to create lip sync animations. I created graphical user interface components and connected the speech and animations to the interface. Here is an example.
How are you feeling today?
Good.
I'm going to examine your head. Is that okay?
Okay.
Can you smile for me? Can you frown? Can you follow my finger with your eyes?
Along with another PhD student, we developed methods to automate touch interactions on a physical virtual patient head. For example, the user can tongue the lips and/or the eyelids. We are working on using the same technology on the full physical virtual patient bed. After development of the physical virtual patient bed, my objective is to use it for research. I am interested in manipulating different sensory cues, for example, the location of dynamic visuals and physical form. I am interested in observing the effects on outcomes such as behaviors, performance, cognitive load, and perception of healthcare providers. This table shows the 4 conditions we used for the experiment using variations of the physical virtual patient bed. The first independent variable is physical formed shell versus flat formed shell. The second independent variable is the location of dynamic visuals being co-located or separate from other cues. I am presently working on analyzing the results. A simulator like the physical virtual patient bed is needed to simulate medical conditions impossible to simulate in a safe, controlled, and memorable way, such as stroke or sepsis. It provides hands-on learning, especially for children patients, as it is impossible to recruit children as actors. It also provides a diversity of patients and scenarios. The impact of the physical virtual patient bed for research is that it provides a controlled environment while trying to get insight regarding the importance of cues and how that affects the healthcare provider's thought process during diagnosis. In the future, the physical virtual patient bed could become a new class of patient simulators. In conclusion, the physical virtual patient bed is a new type of patient simulator that simulates high-level and low-level responses with all sensory cues in one location. The physical virtual patient bed can simulate a diverse population, including children, with a wide range of medical conditions. In collaboration with professors from College of Medicine, College of Nursing, and Computer Science and Engineering, I created the content and developed the hardware and software for the physical virtual patient bed. The physical virtual patient bed is being used for research to understand the importance of different sensory cues in patient simulators.